Hello everyone, Dr. Zach Borus from Dickinson County Board of Health and Lakes Regional Family Medicine in Spirit Lake, Iowa. It is October 7th, and I just wanted to give you a State of the Union in terms of where we are in COVID here in Dickinson County, what's going on at the hospital, give you some resources, and hopefully answer some questions that have been coming up. So I'm going to take off my mask because we are socially distanced, but we are still universally masking here in the hospital. And when with patients, we are wearing at least surgical masks or N95 masks, so you are safe. We are still wanting people to come in for their health care, and just wanted to reiterate that we have a beautiful new clinic, beautiful new entrance on the west side. If you are coming to see us at our clinic, please come in the ER door. But we are pleased as punch that Lakes Regional Family Medicine is now open and everything is running great. You can see a little bit of it behind me, but please come and get your usual routine health care when you're due. Where we are in terms of COVID. So it has been busy lately here in the hospital and here in Dickinson County and here in our region. As you've probably heard, case counts around the region are going up, and we are at the highest level that we've been since June here in our county. Total in Iowa, there have been 95,000 people who have been diagnosed with COVID over the course of the last 8 months, 6 to 8 months. In Dickinson County, we're at 583 total. Nearly 90 of those have been within the last 2 weeks. It's on a rolling average. A couple days ago, the 14-day rolling average was over 90. Now it's at about 75. So we are seeing lots of positive tests, and unfortunately, some of those are significantly ill. So currently at our hospital, we have 8 inpatients who are COVID positive. That is, actually we had 9 over the weekend, but other than that, this is the highest number that we've had throughout the epidemic. So we are stretched. We've had to cancel a few surgeries this week or delay them, unfortunately, but that certainly, obviously we need the beds and we need people taken care of, and we need our staff to stay healthy and flexible. So some of these folks are significantly ill. There are a couple people on heated high flow oxygen, which is just short of a ventilator. We're trying to keep people off of ventilators unless they're absolutely needed. But we've been proning people. We've been using remdesivir, which you've probably heard about in the news. We've had a couple folks who have gotten convalescent plasma as part of their treatment course as well. We have access to pretty much all of these therapies, just like the big places do, but as part of this regional rise, many of our referral centers have also been stretched and have encouraged us to, with support, to keep people here. We do feel confident in our ability to take care of these folks, but this is not COVID light. This is the real deal. We have people who are significantly ill, and we want people to be aware of that. At the same time, people are getting excellent care, and we're proud of what we're doing. Here in our region, so the state has divided up the state into 4 regions. In the Northwest region, which is Region 3, we have 119 people currently hospitalized with COVID. That sort of goes up from Sioux City up to the border and over to about, I don't believe it includes Mason City. But that's the highest it's been. There's 20 plus people in the ICU. There's new admissions. Yesterday was the highest number of new admissions to the hospital in our region that we've seen at all. So again, for whatever reason, numbers are going up around here, and that's being seen across our referral area as well, some in Minnesota and South Dakota as well. So please continue to be safe. Please wear your masks. That is still the best tool that we have for preventing this, in addition to social distancing and hand washing. But really keeping some distance, not being in enclosed spaces with folks, and wearing masks when at all possible. That is to the extent that the Iowa Department of Public Health has just said that you don't need to quarantine if both people who are within 6 feet are wearing masks. So again, another reason to just wear masks. If you think you have been exposed, or if you are having symptoms of COVID, we still encourage you please to get tested. There are multiple ways to do so. Test Iowa is still here. At this point, it is right off of 23rd Street. So you'll go to the road north of the hospital. After you've gone to testiowa.com to fill out the testing questionnaire and selected our site, you can come Monday 8 to 4, Tuesday, Wednesday, and Thursday 7 to 9, and 3 to 5, and then Friday 7 to 9, and get tested. It's free. That's our quickest way of getting you tested. So unless you're severely ill, we encourage you to let us know, but also go there and get tested. If you are feeling significantly ill, if you want to be seen by a doctor, or if you have lots of other comorbid medical issues, call our respiratory clinic still at 336-6696, and we'll get you in. You'll talk to a triage nurse who will go through all of your symptoms and tell you what's the best course of action for you. Of course, if it's an emergency, if you're gasping for air, if you're turning blue, if you're just feeling rotten, go to the ER or call 911. We are feeling stretched but confident that we're able to take care of you here. Just as we go forward, we're coming into flu and cold and cough season. There's a lot of overlap between the symptoms, so I encourage you, if there's a question, if your kid gets sent home from school, get them tested, please. It'll actually get them back to school quicker if they are tested and test negative. Even if they test positive, then it's only a 10-day quarantine rather than 14. So please be honest with your schools. Also, one of the wonderful things that we're seeing in the coming weeks is that we will have the access to some antigen cards, so more rapid testing availability, which we'll give the details on, but that will be for students and teachers and staff at the schools. So that's coming from the state as part of a federal grant, and so we'll roll out more details of that, but our access to quicker testing is going to increase in the coming weeks, so we're pleased. Really, we've been saying the same thing for months, but please take this seriously. Please take care of your neighbors and each other by wearing masks. If you are ill or if you have had symptoms, whether you're waiting for a test or not, please stay home. If you do get tested, then please stay home until you have your results, and if they are positive, please don't go out. If you're feeling ill, please try to separate from your family as well. Find a room that you can stay in and have them bring you food, certainly at least until your test is back negative, because we don't want to expose our families. This is certainly one of the ways that we're seeing transmission. We haven't really been able to pinpoint why this is going up specifically. We probably think it's related to schools and just people being more mixed and more out in public of late, but I think we just need to be very cautious. Encourage your kids to wear masks, encourage your families to wear masks, and continue to do what you've been doing for months. So thank you for your time. We'll keep you posted, and we'll be as honest and transparent as we can with you as we go forward. And happy October. Take care.